India has reported a number of daily COVID cases below 2 lakhs for the first time in 40 days. No, we're not out of the woods yet, but the direction seems to show a reduction in cases. There are still a lot of questions. One, for example, are we seeing more cases in districts of India and rural areas where perhaps tests are not reflecting the true numbers? What about side effects like mucormycosis? What about the third wave? To speak to us on some of these issues, I'm joined now by Dr. Randeep Guleria, Director of AIIMS. Dr. Guleria, thank you for speaking with us here at ET Now. Pleasure to have you on the show. Let me begin by getting your response on the daily count and the drop in numbers. We've been seeing this steadily for 7-8 days now. What would you say is the reason behind this? Are we now seeing the impact of the lockdowns and the localized versions of lockdowns in various states?
That's true. I personally feel that number of factors, aggressive COVID appropriate behavior and the containment of the lockdowns that have been imposed in various parts of the country are actually leading to a decline. And we've seen that in cities like Delhi, Mumbai, where there was an aggressive lockdown for almost 2 weeks or more, which showed a decline in the number of cases. So in part of Western India and Central India, there is a decline in cases, and this is reflected in the overall data that is seen by the country. But if you look at southern part of our country, and if you look at the northeast region, the east and the northeast region, there is still a little bit of a worry because cases there are still significant. And one would want to see a significant decline in these areas before we could say that as a country, in the whole country, that we are now going in a nice trajectory towards the end of the second peak.
The reason I asked you about the cause for the drop in cases, Dr. Guleria, is that if it truly is restrictions that have caused this drop, then it raises a question mark on how we can unlock, because we face possibly the same cycle that we unlock, people start moving around and we have another spike in cases because vaccines and an appropriate number of vaccines being available is some time away.
So that's the biggest challenge. What we have is how do we really sustain the decline that we have, keeping in mind that we still have a susceptible population. And to decrease the susceptible population, the only solution is to vaccinate a large number of people, which we will not be able to do for the next few months at least. Therefore, what we will have to do is develop a strategy where we continue to have some degree of restriction and gradually start opening it up. And then if we find the cases are increasing in a particular area, the positivity rate again goes up significantly, or the number of cases being admitted goes up significantly, we again have a clampdown in that area. This is something that has been propagated for a long time, known as the so-called hammer and dance theory, that if you have increase in number of cases, you bring down the hammer and you have a lot of restrictions. Once the cases come down, you start opening it up a little bit and allow some degree of activities, but keeping a close monitor. So what we need to do is have good surveillance, try and push vaccine as much as we can, keep an eye on the positivity rate in that area, and also the bed occupancy so that we don't run out of beds. And if we find that the positivity rate is low, I would say less than 5%, and you have your bed occupancy is less than 60%, around 60%, that is 40% of beds are still available for COVID patients, then you could say that we could have a limited degree of opening up of restrictions. And then gradually as things become better, you could open it up more and more. But in case you find that the cases have suddenly started increasing in that particular area, you have a very good, again, you bring back the lockdown, you start doing testing, tracking and treating, and make sure that you can break the chain of transmission. This type of policy we will have to follow for the coming few months till we have a large number of people vaccinated.
So what is your, information and what is your view on what is happening in rural India right now? We look at the overall sort of headline daily count number, and yes, it's dropping, but many people, many experts have raised concerns that a reason for this could be that there's lesser testing outside the cities and COVID cases may be spreading there unaccounted for and unchecked. Is that a valid concern, especially when it comes to medical infrastructure in these places?
That's a big concern. And I would say, yes, you're right. One is very concerned about the pandemic moving into rural India because of multiple factors. One is lack of awareness out there. Many people that you talk to in rural India don't realize what COVID is, and they feel this is an illness of cities only, and they don't have COVID in rural India, and therefore are not bothered if they have fever, cough, and cold, and really don't come forward to get themselves tested. So one has to really develop a strategy of really reaching out to people in rural India, making sure they understand the seriousness of the disease and why they should get tested, developing strategies of being able to test them using the rapid antigen test, which can easily be done at homes, and you don't have to rely too much on RT-PCR. If one is negative, then a sample can be taken and sent for RT-PCR. Look at strategies which could be what we call a syndromic approach. You may not have everyone who can be tested, but if he has the classical signs and symptoms of COVID-19, then that person should be isolated, started on some treatment, given facilities to monitor himself, and by maybe the ASHA workers, the ANM should really be monitored closely. And if there is features of breathlessness, fall in oxygen saturation, or high-grade temperature, be admitted to a COVID care center or a COVID hospital. And I think here there has to be a different strategy where there has to be also a lot of teleconsultation, communication, and sick patients should be moved to a district hospital or to the medical college in that area.
But are we seeing more and more cases emerging out of the cities, Dr. Guleria? Because there is a little lack of clarity on what the true picture is. Are we seeing a spread of these cases? Some of these stories are driven by news reports or anecdotal. What are you observing, sir?
So I think the pandemic is now moving into rural India also. There are some plus points there, but unlike urban India, rural India is well spread out in terms of that the crowding per square kilometer is much less than what you would see in urban India in terms of number of people staying in, say, 1 kilometer. And therefore, the chain of transmission, which needs human to human spread and needs people to really be close to each other, is not that much in rural India. But at the same time, the health infrastructure is not as good in rural India as it is in urban India. And that is what needs to be strengthened, whether it's be making sure that there's enough oxygen out there, enough medication, enough people to provide the treatment and monitoring. Remember that in 80 to 85% of people, it's a mild illness, but we need isolation, we need just supportive treatment. But we also need to be able to identify the 15% in whom it can be a severe illness, make sure that they are provided proper care and are transported to a higher center if care is required. So these challenges and the strategies that we would have to adopt will be different than what is being adopted in urban India. And this is something that is already being done at a large scale at the government level in terms of training doctors, in terms of providing kits for management for rural India, and also looking at how we can test a large number of people using the rapid antigen test in rural India.
I want to ask you, Dr. Guleria, about mucormycosis. Now, yesterday you said that identifying it by color would create confusion. There is obviously a lot of panic about this new thing, black fungus, white fungus, yellow fungus, etc. But I'm just going to ask you some FAQs about how it's caused. Some say it's because of an overuse of vitamins like zinc as well, apart from steroids and antibiotics. Some say that industrial oxygen could be a cause, or their containers could be dirty. Some now say that masks could be dirty and be causing this. What is the real picture?
So if you look at data, and there is data which has looked at mucormycosis not only in India but globally, and that recent data which looked at mucormycosis globally really suggested that almost 70% of mucor related to COVID is occurring in India itself. And it linked it to three main factors. One, of course, was the number of cases that we have in our country, the severity of cases. So if you have more COVID cases, and if mucor is related to COVID in absolute numbers, there would be more. Second is, India is also known as the diabetic capital of the world. We have a huge number of people who are diabetics. Many of them are not having a good sugar control. Some of them even don't know that they have diabetes, and it's picked up only when they are diagnosed to have COVID-19, they are tested. And the third is many drugs are available over the counter, including steroids, and therefore you don't need a prescription. And a lot of patients unknowingly, doctors have prescribed steroids in high doses to people who don't need them. And we do know that there is enough data that if you are giving steroids, you are predisposing individuals who have COVID-19 to secondary infection, which could be fungal infections. Now, regarding the use of zinc, there are some studies which suggest that zinc may be linked to fungal infection. That has been there for many years, but we need more data to really prove this one way or the other. There's definitely data which suggests that increased iron in the blood can lead to fungal infections multiplying much more, and iron overload in various diseases is a predisposing factor. As far as oxygen is concerned, whatever data that we have from our country does suggest that almost 10% of people who have got mucormycosis were not on oxygen. They were actually at home taking treatment in the form of steroids and other drugs and had uncontrolled diabetes. So oxygen is not something which is linked to it. But having said that, even if you're using oxygen, which could be industrial oxygen, hygiene is very important for any infection control practices. And whether it be the tubing, whether it be the water that you're using should be sterile, or whether it be making sure that it's the cylinder is properly cleaned, are factors which would be important not only from the fungal point of view, but from any infection point of view. As far as masks are concerned, if the mask is properly cleaned, and if you're using a mask which is regularly washed and it is put out in the sun and dried properly, if it's a cloth mask, or if you're using an N95 mask and again it's used for let's say 8 hours and then it's left out in the sun to dry, then the chances of getting fungal infection through masks is not really there.
You know, a lot of now questions coming up from the line of treatment. Looking back a little, Dr. Guleria, I want you to explain why then were doctors prescribing such heavy doses of steroids and antibiotics, which has led to this outbreak of mucormycosis. Some are describing this as man-made. Was there a flaw in the line of treatment over the last few months?
So if you look at the guidelines are very clear that steroids are required only in moderate disease and not required in mild illness. There is really no role of giving too much of antibiotics. And if you look at what has been done in the West, the treatment for mild cases is only symptomatic treatment. They are not even giving any other drug. They're just giving medication for fever. If you have any cough and cold, then you're getting medication for cough and cold, and that's about it. In our country, what has happened is because of the large number of cases and a little bit of a panic situation, a lot of polypharmacy got started, and this was done by patients and by doctors, and many drugs were given which were really not indicated. And that probably also led to the situation that we are in. We tend to give a large number of drugs, and sometimes we tend to rely more on not the person's clinical parameters, but the blood reports. And sometimes you may have a blood report which may show your CRP to be slightly high. Now, CRP is a parameter which is what we call an acute phase reactant for any infection, even for any inflammation. Even if you had a toothache or you had, let's say, a boil on the skin, the CRP would go up. But many doctors would look at the CRP value, get into a panic situation and say your CRP is high, start steroids. And because of that, a lot of steroids got started. So I think too much of testing by looking at biomarkers and not really looking at the whole picture led to a lot of misuse of steroids in the early days. But these things have now become.
Phase 3, you said that there's no evidence so far to show that kids are more vulnerable. But we also know that several states have set up task forces focusing on preparing medical infrastructure for children. Time and again, there are experts who come and say that kids could be more vulnerable. What is the data showing us so far, and why are kids believed to be more vulnerable? If they are not, then why all this preparation for children in the third wave?
So there are two things. One is, let's look at both the waves, the first and the second wave. And if we look at children per se, in both the waves, children have had very mild illness, and most of the children have come out of COVID-19 without really having any serious problem or requiring admission. As a matter of fact, even in our hospital, only those children who had comorbidities, had underlying immunodeficiency syndromes, or had say cancers, were the ones who had severe illness and really needed admission. Otherwise, most children had a very mild illness, could stay at home and became all right and recovered. So that therefore the data from both the peaks that we've had suggests that as far as this virus is concerned, it does not affect children that much. And this is related to the fact that children possibly have less number of ACE receptors in their lungs, and therefore the virus is not able to attach to a large extent in the body of children as compared to adults. The counter argument that people have put forward is that since till now children have been a protected group and the number of cases in them have been minimum, they are the ones who are susceptible in terms of not being protected either by the vaccine or by the exposure that they may have had to COVID-19. And therefore, once schools open, once play schools are there, once colleges open, then the people will start mixing. And if you have a susceptible population and children and young adults will not be able to have that good COVID-appropriate behavior, the number of cases in this population will possibly increase. That is theoretically possible. Yes, children will possibly not be able to have COVID-appropriate behavior. I don't see children in a play school wearing a mask and having physical distancing. It will not happen in a school itself. And therefore, chances are the children may get more infection. The worry that we have is that children will carry the infection home and give it to the elderly at home or to someone with comorbidities, and they can get more severe illness. But by and large, what the data suggests is the children will have a mild illness and will come out of this without having such a severe problem as far as the last two waves are concerned.
So, is there a case then for aggressive anticipatory vaccination for children? We're asking this question at a time when Covaxin is possibly just going to start its trials for children above the age of 2. In some parts of the world, they're already beginning to vaccinate children above the ages of 12 and will possibly widen it further. So, in your view, is there a case for anticipatory vaccination of children as well, even before the phase 3 hits and before all adults are vaccinated?
So again, there's two ways of looking at it. First is, of course, the children should be vaccinated. Like I said, they would carry the infection home and could cause infection to the elderly. But if you look at mortality data, it's much more higher, much more in the older age group and in those with comorbidities. So if you have to prioritize, I would still say that the priority group has to be those who have comorbidities, who are of the older age group, because they can get more severe illness. But subsequently, yes, children should be vaccinated. And I'm hopeful that in the coming months, the vaccine clearance will be there. The regulatory approvals will be there to vaccinate children, and we would be able to vaccinate them, because that would give us a larger pool of people who are protected in the general population and thereby help in breaking the chain of transmission as far as the disease is concerned.
Last question, Dr. Guleria. We know that it will take some time for enough of the population of India to be vaccinated. The upward estimate is maybe 35% will be vaccinated fully by the end of this year, according to the IMF. What are the risks of not vaccinating quickly enough? Do we then keep ourselves susceptible to more mutations which could then escape immunity?
So that is possible, and that is why one would say that we need to vaccinate as early as possible and cover as many people as possible, because as long as the virus stays and we have a large number of people who are infected, the replication will continue, and as the virus replicates, it will mutate, and therefore new mutations will develop. And once we start vaccinating, there will be pressure on the virus itself to develop an immune escape mechanism so that it can survive against the antibodies that the vaccine has produced. And therefore, we need to work aggressively in vaccinating, not only in our country, but at a global level. Because remember, if you have a variant which emerges in any part of the world, it can travel to the other parts of the world And if that variant is resistant to vaccine, it will affect everyone. That is why there is a need to really aggressively work on vaccinating not only in our own country, but across the world, because this is what we saw. We had the UK variant, and we felt in January that we were in a good condition. The cases were less. Vaccine had started out. But then we had variants which came into our own country, the B117, which was more infectious, and it spread like wildfire in our country and caused a huge spike in the number of cases. Therefore, we have to be very vigilant. I think along with vaccination, it's important to have very aggressive surveillance data, both in terms of genome sequencing and to look at how cases are occurring in each area. And like I said in the beginning, if you find that there is a sudden increase in cases in a certain area, you have to clamp down aggressively so that it doesn't spread to other parts and lead to this huge surge that we've seen as far as the second wave is concerned.
And do you truly believe that the third wave can be avoided completely?
So I think we will have waves, because respiratory viruses are known to come in waves, and we've seen that for many viruses, including influenza. The challenge is to minimize the third wave. In other words, make sure it probably doesn't really hit us as much as the second wave, or doesn't hit us at all. And to do that, there has to be community participation. We have to be still very diligent about COVID appropriate behavior, whether it's wearing a mask, whether it's avoiding crowds, avoiding functions, and at the same time maintaining physical distancing. And also come forward to get vaccinated when your turn comes, so that more and more people get vaccinated in the shortest period of time. If we do this, I'm sure that with surveillance and with the lockdowns happening off and on, we will be able to avoid the third wave.
All right. Thank you so much, Dr. Guleria, for joining us today, Director of AIIMS, outlining for us what the strategy needs to be going forward. Our numbers are coming down from the peak, but we cannot really relent easily. We definitely don't want to repeat the mistakes after the first wave. Thank you so much for your time, Dr. Guleria.